Salt is one of those things everyone knows is bad in excess, but almost nobody actually understands why. You have been told to watch your sodium intake your whole life. Cut back on processed food, put the salt shaker down, read the labels. But the mechanism behind all of that advice, what salt is actually doing inside your cardiovascular system step by step, rarely gets explained. That changes today, because once you understand the chain of events that too much sodium sets off in your body, the advice starts making a lot more sense, and you get a lot better at acting on it. Let us start with something that often gets overlooked. Your body genuinely needs salt. Sodium is an essential electrolyte. It helps regulate fluid balance inside and outside your cells. It supports nerve signaling. It is necessary for muscle contraction, including the muscle that keeps your heart beating. Without enough sodium, your body cannot function properly. The problem is not salt itself. The problem is the enormous gap between how much your body needs and how much most people are actually consuming. The recommended daily limit for most adults is 2,300 milligrams of sodium per day. The average American is consuming over 3,300 milligrams daily. That is a 1,000 milligram overload every single day. And most of that excess is not coming from the salt you add at the table. It is coming from packaged foods, restaurant meals, canned goods, and processed snacks, where sodium is added in quantities most people never see or think about. So what happens when that daily overload accumulates over months and years? The first thing that changes is your blood pressure. When you consume more sodium than your body needs, your kidneys, which are responsible for filtering sodium out of the blood, begin to struggle with the volume. To compensate, your body retains more water. The logic is simple. More sodium in the blood means the concentration is too high. The body dilutes it by holding onto fluid. That extra fluid increases the total volume of blood circulating through your vessels. More blood volume means more pressure on the walls of your blood vessels with every heartbeat. Your heart has to pump harder to push that greater volume through. Blood pressure rises. For some people, this effect is more pronounced than others. Researchers have identified a trait called salt sensitivity, where certain individuals experience a significantly larger blood pressure increase in response to sodium than others. But even people who are not especially salt sensitive experience cardiovascular strain from consistently high sodium intake. The difference is in degree, not in whether the effect exists. The second thing that happens is damage to the blood vessels themselves. High blood pressure is not just a number on a monitor. It is a mechanical force acting on the interior walls of your arteries every time your heart beats. Over time, that force causes micro damage to the endothelium, which is the thin layer of cells lining the inside of every blood vessel in your body. When the endothelium is damaged, it loses some of its ability to relax and expand in response to blood flow. The vessels become stiffer, blood has a harder time moving through smoothly, and damaged endothelial tissue becomes a site where inflammation takes hold and where plaque, made up of cholesterol, fat, and cellular debris, begins to accumulate. This process is called atherosclerosis. The arteries narrow, blood flow to the heart and brain becomes increasingly restricted. The risk of heart attack and stroke climbs with every year that high blood pressure goes unaddressed. But the damage does not stop at the vessel walls. Research has shown that high sodium intake disrupts the gut microbiome in ways that further harm cardiovascular health. Excess sodium lowers levels of beneficial short-chain fatty acids, compounds produced by gut bacteria that have anti-inflammatory effects on the cardiovascular system. At the same time, it raises levels of a compound called TMAO, trimethylamine N-oxide, which is associated with increased cardiovascular risk. So the damage pathway from too much salt runs through your gut, as well as directly through your blood vessels. The third consequence is the long-term strain on the heart muscle itself. When the heart has to work harder than normal over an extended period, it responds the way any muscle does to sustain strain. It changes its structure. The walls of the heart thicken, the chambers may enlarge. These structural changes reduce the heart's efficiency and increase the risk of heart failure, a condition where the heart can no longer pump blood effectively enough to meet the body's demands. Heart failure, stroke, and heart attack do not happen overnight. They are the end point of a process that builds quietly over years of elevated blood pressure and arterial damage. By the time symptoms appear, significant structural damage has often already occurred. Now let's talk about what you can actually do about this, because the answer is not to eliminate salt entirely. The most important shift most people can make is not at the table. It is in what they buy. The vast majority of sodium in the average diet does not come from cooking at home or from the salt you add to food yourself. It comes from packaged and processed foods where sodium is present in amounts far beyond what most people realize. A single can of soup can contain 800 to 1,000 milligrams of sodium. One serving of deli meat can contain 400 to 600 milligrams. These numbers add up to thousands of milligrams before you have touched a salt shaker. Switching to low-sodium versions of canned goods, soups, and cooking stocks is one of the highest impact changes you can make. Reading labels before you buy becomes a meaningful habit rather than a tedious one once you understand what those sodium numbers actually represent for your heart. Cooking at home more often gives you direct control over what goes into your food. Restaurant meals are among the highest sodium sources in most people's diets, with single dishes sometimes containing more than a full day's recommended intake. When you do cook, herbs, spices, and acid are your replacements for salt. Fresh garlic, oregano, cumin, paprika, lemon juice, and vinegar can add layers of flavor that make food satisfying without relying on sodium. The adjustment takes a few weeks because your taste buds have adapted to high salt levels, but research shows that palates recalibrate when sodium is reduced gradually. Food that would have tasted bland eventually tastes normal, and then food that used to taste normal starts tasting oversalted. One more practical tip that tends to make a real difference: taste your food before you reach for the salt. Most people salt their food out of habit before they have even taken a bite. When you do use salt strategically, adding a small amount at the very end of cooking or directly to the surface of food before eating, you get more impact from less sodium because the flavor hits your taste buds immediately rather than being cooked into the dish. The takeaway is not that salt is poison. It is that the dose matters enormously, and most people are far beyond a healthy dose every single day without knowing it. The heart is resilient, but it is not infinitely resilient. And the decisions you make about sodium today are quietly shaping your cardiovascular health for the years ahead. The process starts long before any symptoms appear, which means the best time to pay attention to it is right now, while the damage is still reversible. If content like this helps you understand your body and make smarter decisions about your health, subscribe. There is a new video every single week.